I'm Dr. Paula Holt, Pro Vice Chancellor and Dean of College of Health Psychology and Social Care. I just want to take a few minutes to say thank you to all of you who are studying nursing programmes with us here at the University of Derby. We're incredibly proud that you're still on your programme, that you stuck with it, and that we are still able to hopefully deliver you through your programme and into the workforce on time. I know that many of you have struggled. I am very, very aware of the workload that you've been carrying in terms of the theory, the practice, whilst many of you looking after children, shielding loved ones. There's been so much going on in your lives, but you've still found time to dedicate to your programme. And that just shows the tenacity that you have.
Still here. You've done remarkably well to be continuing with your studies at this very difficult time.
COVID's the big illness that's hanging on top of everybody, but it's the big thing that's influenced our lives since March in many, many different ways this year. Not just personally with your family life and friendships and what have you, but it's featured an awful lot in work life.
This past year, I don't think any of us thought we'd still be in this situation when we went into the first lockdown back in March, but here we are.
All the support services and wellbeing services will continue to happen at the University of Derby. Many of them have moved to online and remote opportunities, but the core offer to support and help students where they need it is still there, and we would ask you that you continue to reach out.
It's been a strange old year. For our first years, well done. For those of you that started in March, I think you had a couple of weeks with us before you got sent home, and then had to transfer to working remotely, which was difficult for you guys, difficult for us as well, but you know, you all really took to it really well. For those of you that started in September, what a strange 6 months leading up to joining us and starting your university life.
We're really grateful you've stuck with us. It's not been the easiest year. There's been a lot of challenges. A crash course in technology for most of us.
I know how difficult it has been for everyone, not just being a student nurse, but personally, as well as many of you working as healthcare assistants as well. But from my perspective as a lecturer that's had the privilege of sort of working with you and supporting you over the last 7-8 months, you know, you really have been brilliant. You've been tremendous. You've tackled everything that's been thrown at you.
On behalf of the technical team, I'd just like to say that we can acknowledge that it's been a very different setup for you as students this year. And when you've come into the university, there have been hygiene requirements that are far beyond what you've been asked to do before. And we really appreciate the efforts that you've made to keep yourself and everyone else safe.
Thank you for all your hard work that you have been engaged in this year. It's been a difficult and challenging year for yourselves, and we know that it has not been very easy, but we have all come through this.
We do recognise how hard that you've all been working throughout this year and coping with all the changes that have been happening. We are extremely proud of you.
We're really, really grateful to all of you for your hard work, your patience, your flexibility, and a lot of laughter in team meetings, which has made it all worthwhile in teaching sessions.
This year, next year, and for the rest of your lives in your nursing career, you will always remember learning and working through a pandemic.
A huge well done to everyone for your perseverance and all your hard work throughout this year. It's been such a challenge, but you've come through it the other side.
2020 has been off the scale in terms of challenging, and you guys have been out there, you've been working within the health services, working with staff during a pandemic.
You've been at the kind of very forefront of the kind of fight in terms of the COVID response and the pandemic response, and we're absolutely delighted that many of our students have contributed to that, and without your involvement we wouldn't have been able to deliver the service that the NHS has continued to deliver. So we're really, really thankful and proud of you.
We'll all look back to this year 2020 and wonder how we ever coped, but you, I'm saying every single one of you, whether you're on the Nursing Associate Programme, undergraduate or postgraduate registered nursing programme, you are going to be so valued by the workforce, and the experience you're having now is difficult, but I'm sure it will just make you a better nurse.
The absolute dedication and the enthusiasm to your studies and to the professions that you're about to join is absolutely commendable. I was really struck by your ability to cope and adapt with the difficult situation that we've found ourselves in, and that's really key to being a future professional nurse.
I want to say something about the staff, both technical and academic, that have been supporting you. I know that they have worked so creatively and innovatively to try and make sure that you achieve your learning outcomes, that you have exposure to the right training, the right skills. And what I've seen over this past few months is more innovation and creativity than I would have seen at any other time.
We at the university quickly had to find ourselves adapting to that situation. And as a result of that, I had to make a number of changes to curriculum and to module delivery and of course to our educational model. And that really required us to essentially move to a blended approach. For some, that's been a fantastic opportunity to explore new avenues for learning.
Online learning has become a large part of what you've been doing, and hopefully the efforts that we've been making to facilitate that have come across okay.
We've learned more about how to offer simulated, virtual and other types of remote placements that allow people to engage in experiences that teach them how to deal with different situations, how to engage in clinical skills in a way that helps develop their competence. So all of you as students have been fantastic in allowing us to be innovative and creative with you with your learning.
You have been very supportive of us as we have tried to get to grips with technology, and I know that you've been getting to grips with technology at the same time, and we've missed each other in the middle a few times, but most of the time we've got together, and what I've seen online is that you've really risen to the challenge.
We do recognise how hard that you've all been working throughout this year and coping with all the changes that have been happening. We are extremely proud of you.
You're all amazing. There's people that couldn't go out to placement because of their health, and our thoughts are with you. It must have been really challenging and difficult for you, but you've stuck with it and kept going and engaged with all the simulated activity that we've done.
I am aware as well that placements have been difficult. Many of you have had placements interrupted, many of you had placements that have been delayed, or placements that have not been where you thought you would be going. And that's been really difficult for us to manage, because clearly the NHS has had to change the way that it's run its services because of the pandemic. But what I'm hoping is that the experiences that you are getting, you're making the best of. We will make sure by the end of your curricula that you have had all the placements to deliver you as a competent registered nursing associate or registered nurse. But thank you for your patience and understanding in the fact that we've been responsive to the NHS and other government guidance in terms of what we can do with regard to placements.
You have been absolute stars, and I think that has shown in all of the work that you've done. And I know that that's what the practice also, practice colleagues out there on the floor think as well. They have given us lots of feedback in the practice module about how fabulous you've been out there in clinical practice. And I know that that will continue in 2021.
It's lovely to see how people have grown and developed this year. So I'm looking forward to seeing more of you next year. Hopefully we'll be back in our lovely building at St Helena's.
Having the experience of working in clinical practice, during this pandemic will go with you throughout your career.
We are very proud of you as students. We know you've had very, very tough times and still tough times to come. And it makes us immensely proud when we mark your work and we see what you're capable of.
What I can say is, from teaching you remotely, teaching online, we've thoroughly enjoyed trying to get to know you, but we hope next year we'll be able to get you in and we'll be able to teach you face to face, actually get to meet you, actually get to see you properly.
Whether you celebrate Christmas or not, I hope you all get the time to rest, to recuperate and come back to 2021 with a smile in your face and some optimism.
Hopefully things will get a little bit easier for us.
the majority of what I see for everybody is that ability to actually not just survive but thrive.
We're getting it together, we're really optimistic, we've got a vaccine, and let's hope that we can keep going with placements, trying to give you an innovative approach to your studies.
Vaccine is going to get rolled out and we'll all be involved in that. So these experiences are going to just help us to develop as practitioners.
So we're really, really grateful, and we're looking forward to a much better next year when we actually get to see some faces and get to meet you personally. That would be lovely.
You may yourselves be involved in supporting our recovery, because I know we have put out a flyer asking for students to volunteer to work as healthcare support staff to deliver vaccinations when that programme starts. So you could be part of the solution as well as obviously recipients of it. So be optimistic about 2021. Let's get back on track in the new year. And let's hope that the forthcoming calendar year is going to be one where we see recovery, some form of normal starting to come back, which allows you to study in hopefully a more traditional way.
We've learnt new things, all of us, and things might never be quite the same, but at the same time things will definitely get better.
You're going to go out there and absolutely smash it when you qualify.
So carry on learning, carry on working hard. You are working towards a fantastic career, and you'll get your pin at the end of it, and you'll be as proud as I am to be a nurse.
So have a lovely break, and hopefully I'll see you all soon in the new year.